Eastern Cape Premier Oscar Mabuyane has commended the impact of lockdown level 3 in slowing the COVID-19 cases in the coastal province. Briefing the media on the province's response, Mabuyane urged residents to continue to adhere to regulations. The province is leading with COVID-19 deaths at over 7,700. Now, for more on this story, I'm now joined by Thobile Mbengashe, who is a special advisor of the Premier. Mr. Mbengashe, thank you so much for your time this afternoon. Now, obviously, as the country battles the second strain of COVID-19, what's the latest there in the Eastern Cape?
Good afternoon to you and to your listeners. I think what's important in the Eastern Cape is that the Premier, together with the ESCO, started the intervention against the resurgence as early as October. What we have seen a major change in Sarah Baartman and Nelson Mandela, where numbers in the past 14 days have consistently dropped, and they're going towards a much more stable and a decline. And we're starting to see that same process happening in all other districts, especially BCM, Buffalo City, Amatole, and Chris Hani, showing the similar trend. We think that the level 3 that the president did actually announce, and the current restrictions around large gathering, the closure of beaches, and really the mandatory wearing of masks will sustain the ongoing decline in the new numbers. That then actually saved the hospitalization, and we expect that the active cases are going down as well.
Now, you're attributing these numbers going down to the fact that we are currently on level 3 and also that there is that 9 p.m. curfew. Are these numbers that you're talking of particularly related to the trauma units, or are we talking here about COVID-19 specific cases?
We're talking about COVID-specific cases because what's really important about the overlay of our hospitals and the stress that we have on hospitals have always been driven by COVID-19 cases. Once you reduce the number of new cases, then the hospitalizations go down. And of course, the curfew plus the alcohol ban has also added quite a substantial reduction in the number of cases that are usually very high during this period because of violence, accidents, and other traumas. So we've had a very double gains, both in the trauma area and in the COVID area because of all these interventions.
Now, with the Eastern Cape being amongst the top 3 provinces that is at that high risk in terms of COVID-19 numbers, and I mean, you leading in terms of the death numbers in the country, how worried are you that come January 15, that we will perhaps move back into level 1? What is your take as a province in terms of where the country should be following that review on the 15th of January?
We think that what's important that there are very critical what is called early warning metrics in the COVID. One of the most important things is really the reduction of the active cases, which is really a function of the new numbers being much less than the people who are actually recovering. And that number is usually actually reinforced by what is called a recovery rate, which has gone up in the province and is gone up to 92%. If you look in the Eastern Cape, is that our epidemic of the second wave actually come much earlier than any other province. In the last first wave, Western Cape started early. We were about 2 weeks behind Western Cape. This time around, Eastern Cape came early. And we are starting to see the impact that the high numbers of death are really the numbers that are actually reflecting the number of cases that we had in November and in December. And those numbers usually takes about 3 weeks before we really experience the death. So we think that we're actually going over the worst cases of death in the province. And obviously the death in the province are also supported by a number of what is called the socioeconomic issues. We think that there are a high number of elderly people, there are a high number of people with comorbidities, there are a high number of people with very strong and actually chronic respiratory problems. So we're very confident that by the time the winter comes, with the current rate of the decline and the stabilization of the epidemic and a very stringent government interventions, we should actually be able to waive our situation towards actually the start of the vaccine, which will be the most definitive ways of actually dealing with the containment of the COVID-19.
Now, while the Western Cape has not yet seen its peak in this new variant and this new strain, the Eastern Cape has perhaps reached that peak. Now, how are your hospitals in terms of capacity looking at the moment?
This is actually very important because what we have seen in the height of the peak, we used to have about 200 admissions a day. That has actually dramatically gone down to about 50 now. And when we look in terms of the capacity of the province, we have over 4,000 COVID beds. Now we have about 1,800 beds that are actually being used in the COVID. We have a high numbers of what is called critical care, about 687. We just have less than about 300 of those. So that's a very important part that is actually relieving the pressures in our hospitals. But what we are concerned about, of course, is that the number of healthcare workers that actually work are actually not immune against COVID. So we are constantly trying to make sure that we're in the curve, we're in front of the curve. So the province and the Premier have now agreed and actually supporting about 110 community services that will be given jobs as early of January. Around February, we'll have an additional 651. These capacities are helping us to continue making sure that capacity for managing patients, provision of oxygen, good quality care, and high care services, including ICU, is available when we have it. But we really see a very positive sign that numbers are going down. The stress in our hospital is going to go down, and we should be able really calm down and have a much more less onerous position in terms of new cases and our services being overwhelmed.
Dr. Mbengashe, I'd like to continue with this conversation. So please, just stay on the line as we continue this conversation. I still have a couple of questions that I'd like us to go through in terms of those numbers in the Eastern Cape. We continue with our conversation after the break. Stay with us. Welcome back. While we continue with the conversation on the Eastern Cape and how that province is handling COVID-19 cases. Now, earlier, Premier Oscar Mabuyane commended the impact of lockdown level 3 in slowing the COVID-19 cases in the coastal province. I'm in conversation now with Thobile Mbengashe, who is the special advisor of the Premier. Mr. Mbengashe, thank you so much for staying with us and for your time. Now, as we go back, to work mode and people coming back to holidays and some people perhaps leaving your province, what are some of your plans in terms of just accepting back those numbers of people that had left the province and are coming back, are slowly making their way back, considering that some of them will be coming from hotspots areas that have been identified in South Africa?
Yeah, no, I think that's very important. And I think what we really know the COVID in terms of our community is what is called a community spread. Secondly, that it's also true that where there are high infections in a district or in a province, the chances of getting infections are very high. We have been really reliant, and I think this is very important in terms of how we understand the adjusted level 3's impact. What that level 3 impact does is that it actually forces everyone to stay at home from as early as 9 o'clock until 6 o'clock. That is really a population-based quarantine, and that reduced the transmission. The second issue that's really important is that large numbers, in terms of large gatherings, which are the super spreader events, these have been reduced to around 50, and that also reduced the number of transmission between the index and the new cases. The third most important thing is the mandatory wearing of masks. We know now masks, if they can be, and especially with the mandatory, if you have about over 95% of population wearing masks, the impact of that is equally as if you're actually level 4 or level 5. So what is going to happen is that even if people are not in the province, in terms of this generalized lockdown adjusted, we are actually confident that in wherever they are actually being prevented. We have actually added one additional measure in terms of really making sure that anyone who comes into the borders, we provide a very strong and stringent government intervention to make sure that these restrictions are adhered to, especially on the transportation. Sanitizers and wearing of masks over the nose and the mouth is critical. So we are confident that the impact of the level 3 is actually a generalized impact. It actually goes beyond the hotspots like Eastern Cape. It actually impacts in every provinces. So that's going to help us quite a lot. And this is why we're very confident that because of our numbers are going down, the added impact of the adjusted level 3 is going to make us to sustain those numbers.
Now, let's touch a little bit about the behavior of people, during this time and the lack of compliance. Now, we're understanding there's a trend coming out of the Eastern Cape where people are exhuming, those loved ones that they've buried because they want to perform cultural rituals. How worried is the Premier around this matter, and also how extensive is it?
The Premier has raised the matter much earlier, where we have seen it now, and the Premier has really been in conversation with the chiefs and Amakhosi in all the provinces, and he had a meeting about 2 days ago. He raised this matter very strongly because it's not really in line with the cultures. And the second one is that even though people are concerned about the manner of burials, is because we are trying to make sure that nobody in all our districts is actually catching COVID because of the funeral. The Premier has actually asked and said, look, if we can make some conversation with all the leadership and see whether there are other very culturally acceptable ways that are sensitive to the cultures to make sure that nobody has really the urge or in terms of a cultural pressures to go and exhume bodies. Obviously, exhuming bodies without permission is an illegal act, and people who do so could actually get into trouble with the law. So we are very communicating, and we're sharing the information, and we're making sure that people understand that there is a reason why we are actually doing what is called ukusheka with our current burial systems.
Now, another trend that's also happening in KZN, not particularly in the Eastern Cape, is that people are seeking help late. Mr. Mbengashe, I hope you are still there. Is that the case in the Eastern Cape as well? What would you attribute that to?
Yes, we have actually noted this, and the way you measure this, it's really in two ways. One is the fact that if someone comes into the hospital and within 72 hours actually passes on, and someone passes during the casualty or while in bed, this actually shows that the person came very late. We know that one of the challenges that we are finding is that people believe that being in hospital is what actually kills people. And we're really communicating very strongly that the new methods of managing COVID even when you've got multiple conditions, the idea of having oxygen early makes a huge difference in recovery. Secondly, the provision of a dexamethasone that really tone down the levels of response of the body makes a huge difference in terms of people who could go to ventilation. And the third issue that we're really providing is really what is called high flow non-invasive oxygen. That actually, a ventilation, that actually makes a big difference. So our call to people, come early. And we have actually made provision that extend the ability for us to allow people to isolate in hospitals. For instance, of the 4,327 COVID beds, we only have about 1,800 of those. So we are much more open for elderly people and those that are at risk, that they should come early so that we monitor them and we can intervene much earlier than it is if they come late. So it is a problem that we're worried about. It's a problem that we're communicating to communities to come early. There are beds available, there is oxygen available, and there's critical care. And the elderly with comorbidities are the ones that we're really worried, and we want them to come early in our hospitals.
I mean, I've indicated this earlier. There are currently 7,700 deaths in the Eastern Cape at the moment as we speak. Do you think that this trend of people coming late to hospital and some opting to die at home, do you think that that is part of the cause of the rising deaths there in the province?
I think it's partially a contributor, but I think we need to understand how do we really get to read the numbers of death. If you have the COVID early, for instance, if you look in terms of the numbers in December, in November in the province, we have over 33,000 of people who actually were sick in November. And we had another 34,000 people who were COVID positive. Those individuals takes about 2 to 3 weeks. Now, other provinces which actually are behind about 2 to 3 weeks, they will probably have a lower numbers. So what we think is happening in the situation is that there are too many young people who are getting an infection who actually have asymptomatic diseases and they don't know. So there's probably much higher number of people with COVID that do not come test. And that actually translates in people coming as people who actually have severe disease or actually dying. The second one is really the fact that there are a lot of comorbidities in the province, especially respiratory problem of people who are in mines with silicosis and other difficulties. And there's also the second part, the non-communicable disease. Diabetes, hypertension, and obesities are very major contributors. If you've got more than 3 of these, and your chances of dying is very high. If you are really an elderly over 65, you've got more than 3 morbidities, your risk of dying is over 20%, meaning that the 4.3% of the case fatality rate in those communities and those actually age group is actually multiples of that. So we think the way we're going to deal with this is to actually urge elderly people with comorbidities and people that are obese, they must admit themselves early so that they can benefit in the interventions that is really life-saving in terms of a new understanding how to treat COVID.
Mr. Mbengashe, I've got about 2 to 3 more tops questions that I'd like to further engage you on. But let's perhaps go back to what you said earlier in terms of the hospital capacity and how it has alleviated a lot of the stress, especially when it applies to healthcare workers. Now, we know that healthcare workers in your province particularly have been hard hit, not only from an infection perspective, but also from a morale perspective, because they've been working long hours under strained conditions. What is the situation there with healthcare workers, and how is the province trying to alleviate just some of the strain there?
No, that's a very important question. I mean, I practice medicine. I'm a doctor and I've specialized in medicine. And so I've worked in hospitals. I really understand the challenges that the healthcare workers are experiencing. In the province, we have about 9,300 healthcare workers who have COVID. And if you look at their rate in terms of the
All right, we seem to have lost Dr. Mbengashe there. He was giving us an update on those numbers in the Eastern Cape. The Premier of the Eastern Cape, Oscar Mabuyane, had a media briefing earlier on, and he actually commended the impact of lockdown level 3 in slowing the COVID-19 cases in the coastal province. I think we have Dr. Mbengashe back on the line. Dr. Mbengashe, you were telling us about just the current situation in hospitals as it relates to healthcare workers.
Yes. Now, this is very important. I mean, when we think about healthcare workers, is that healthcare workers are at high risk. And we have about 9,300 healthcare workers who actually contracted COVID. About 161, regretfully, of those actually passed on. That gives us an average about 1.7 per 100,000 if there were a total population, which is about a half of the 4.3 of the total population who are non-healthcare workers. If what we truly do is to make sure that we have created a number of interventions, one of them is really to make sure that the personal protection equipment is available. 2, set up occupational and health committees to make sure that the risk of infection in healthcare facilities is managed. And then 3, we really built up a very strong, infection prevention control and making sure that people are retrained and making in terms of how they really protect. What is really important also, of course, is the fatigue amongst healthcare workers. And what the province has actually done, it has really gone out of its way to make sure that the new doctors out of post-community services, they have been offered all of them jobs. We are adding around 310 additional new healthcare workers to try and support those that are in service, and those are starting in January. In February, we're going to have another 651 of nurses that are actually going to be added. We are having a much more difficulties in finding the healthcare professionals, and we're really asking any healthcare worker who's actually out there who needs a job must really come forward and actually join the department. So the last point, really, what we're trying to do is that we really feel the president has really raised this, and the premier has been on this. We had this special service during the in the midnight in December to really make sure that we are really appreciating and we really are with the communities and the families of those individuals that lost their loved ones. Unfortunately, because everyone is not immune to COVID, and we are finding this. But I think in terms of what is done, in terms of our communication with our social partners, the things that needs to be done, we're really focusing onto that and making sure that healthcare workers are provided. As you know, that when the vaccine comes, healthcare workers will be the first group that will have the vaccine, and the minister has actually made this very clear that the first 10% of individuals will be healthcare workers that will get the vaccine, and that will go a long way in protecting them and actually making sure that at least they're able to be protected and their families.
Dr. Mbengashe, final question from me because we have run out of time. Schools opening in about 3 weeks' time. What are your concerns there around the opening of schools? We've seen several schools that were meant to open in certain quarters are now also just pushing that date a little bit back. Your schools also supposedly opening around the 20th of January. What is the decision that you will be taking around schools?
I think you're quite right. I mean, it's always concerning when schools are open. We know that the young people fare very well against COVID, but we know that they can also transmit. What we are really focused on is what is called risk-adjusted intervention, making sure that, the number of people in the class are actually keeping the social distances, the mandatory wearing of masks, that is actually done, the regular testing of the teachers and other people in schools. And we have actually done this much more strongly during this marking period, where we insisted, and over and above national guidelines, that every person who comes to a marking must actually be tested. And we're very pleased that we've got the new rapid test, which is actually quite effective in giving us results within 15 minutes. So all these interventions of getting, complementary hybrid system, some work is done at home, some work is done in class, and we're actually making sure that the classrooms are smaller and the social distance is practiced practice, and people are wearing masks. If we keep all these interventions, which we do, and in communications with our social partners, we think we can, with the risk-adjusted system. But if an outbreak happens in school, we do take very stringent action of actually making sure that the school is closed, decontaminated, and allowed to test those that were in contact.
Dr. Mbengashe, I really do appreciate your time this afternoon. Thank you so much for your generosity. That was Dr. Thobile Mbengashe, who is a special advisor to the Premier of the Eastern Cape.